The benefits of hormone replacement therapy for women. For over 2 decades, hormone replacement therapy has been shrouded in fear and misinformation, leaving countless women to endure menopause symptoms without the relief they desperately need. It's time we set the record straight, because the benefits of HRT are highly undeniable. So make sure you stick to the end of the video, because you'll be helping yourself and many other women get the right information. The fear of HRT began with a now infamous study, the Women's Health Initiative, in the early 2000s. This NIH-funded research aimed to uncover the risks and benefits of hormone therapy. When preliminary findings were released in 2002, the public was bombarded with terrifying headlines like, HRT increases breast cancer risk by 26%, stroke risk up by 41%. Fear swept across the nation, and millions of women stopped taking their hormones overnight. But here's the problem. The study was never designed to apply to all women. It focused on postmenopausal women over 60, the age group with health risks inherently different from younger menopausal women. For women in their 40s or 50s, who are still navigating the tumultuous waters of menopause, those dire warnings simply didn't apply. Now, to the heart of the matter, what can hormone therapy actually do for women under 60? The answer is quite a lot. HRT isn't just about easing the discomfort of menopause. It's a powerful tool that can improve your quality of life in numerous ways, like 1. Strengthen your bones and reduces osteoporosis risk. As you age, your bones naturally lose density, and menopause speeds up the process. Estrogen plays a critical role in maintaining bone strength, so when your levels drop during menopause, your bones become more vulnerable to fractures and osteoporosis. Here's the good news. HRT can help slow down bone loss and even promote stronger, healthier bones. Think of it as giving your skeleton a protective shield, reducing your risk of breaking a bone during everyday activities. Stronger bones mean greater independence and mobility as you age, something we all want to hold on to. Apart from strengthening your bones, HRT eases menopause symptoms: hot flashes, night sweats, insomnia, and even brain fog. If you're experiencing these, you're not alone. Menopause symptoms can range from mildly annoying to downright debilitating. They're caused by hormonal imbalances, particularly a dip in estrogen and progesterone, which disrupt your body's usual rhythm. HRT helps restore balance to your hormone levels, reducing these symptoms significantly. Imagine sleeping through the night without waking up drenched in sweat or going a full day without feeling like your body is hosting a surprise heat wave. HRT can make that happen, helping you regain control over your daily life. Another benefit is that HRT revives your sex drive and tackles vaginal dryness. Menopause doesn't just affect your mood and energy, it also impacts your sex life. A drop in reproductive hormones can lead to a noticeable decrease in libido, and for many women, vaginal dryness can make intimacy uncomfortable or even painful. HRT helps restore estrogen and progesterone levels, which can do wonders for your sex drive. It also improves vaginal health, making intimacy more enjoyable and comfortable. With HRT, you're not just getting your libido back, you're also rekindling intimacy and connection with your partner. And if you think that's the best one, wait until you find out that it boosts your mood and reduces emotional swings. You've probably felt like your emotions are on a roller coaster ride that you didn't sign up for. Well, hormonal changes during menopause can significantly impact your mood, leading to irritability, anxiety, or even depression. It's not just in your head. Your hormones are genuinely affecting how you feel. HRT helps balance these hormone levels, which can stabilize your mood and lift feelings of sadness and anxiety. Many women report feeling more like themselves again after starting HRT. Think of it as getting back your emotional equilibrium. A calmer, happier you is just around the corner. And lastly, but not the least, HRT helps manage weight and hormonal weight gain. Weight gain during menopause is a struggle many women face, and it's often tied to hormonal changes. Even if you're eating right and staying active, those stubborn pounds may seem impossible to shed. While HRT isn't a magic bullet for weight loss, it addresses the hormonal imbalances that can contribute to weight gain. By restoring your estrogen and progesterone levels, it makes it easier to maintain a healthy weight when combined with proper nutrition and exercise. It's like giving your body a fighting chance against those extra pounds. Types of HRT and customization. When it comes to HRT, there's no one-size-fits-all approach. In fact, one of the best things about HRT is the flexibility it offers. as there are several different forms of treatment that can be tailored to suit each woman's unique needs and preferences. So let's break down the options and highlight how you and your doctor can find the best fit for your lifestyle and comfort level. First, let's talk about pills, the most traditional and widely used form of HRT. Oral tablets are convenient and easy to take, often prescribed in combination to replace both estrogen and progesterone, or progestin. They work well for many women because they're straightforward, but they do have a downside. For some, they can cause nausea or headaches, especially when starting treatment. If you're someone who prefers a simple, daily routine and doesn't mind swallowing pills, this could be a solid choice for you. Next, we have patches, which are a popular alternative to oral HRT. These small patches stick to your skin and release a consistent dose of hormones throughout the day. Many women prefer patches because they bypass the digestive system, reducing the chance of side effects like nausea. Patches also offer the convenience of not having to remember a pill every day. You simply change the patch once or twice a week, depending on your doctor's instructions. For women who want a more low-maintenance option, patches can be a game changer. For those who prefer something more hands-on, gels are another great option. The hormone gel is applied directly to the skin, usually on your arms or legs, and absorbed into the bloodstream. This allows for a more customizable dose, which is particularly helpful for women who need a specific amount of estrogen. Gels can be a little more involved than patches, as you need to wait for the gel to dry before putting on clothes, but many women find them effective and well tolerated. Plus, it's a good option if you have sensitive skin or prefer a more targeted approach. If you're experiencing more localized symptoms, such as vaginal dryness or discomfort during intimacy, vaginal rings might be the solution. These small, flexible rings are inserted into the vagina and release a steady amount of hormones directly where they're needed. They're not absorbed into the bloodstream in the same way as pills or patches, so the side effects tend to be fewer. Vaginal rings are especially effective at addressing vaginal dryness, discomfort, and urinary issues, common symptoms of menopause that many women find hard to talk about. They can stay in place for a few weeks before needing to be replaced, making them a low-maintenance choice for those with more localized symptoms. Now, the real beauty of HRT is the ability to customize the treatment to your unique needs. Whether you're just starting menopause or dealing with more severe symptoms, your doctor can work with you to find the right combination of hormones and delivery methods. For example, some women may need only estrogen if they've had a hysterectomy, while others might need both estrogen and progesterone to protect against the risk of uterine cancer. HRT can also be adjusted based on how your body responds. If one type of treatment isn't working or you experience side effects, your doctor can make changes such as switching from pills to patches or adjusting the dose. And for women who are worried about long-term effects, treatment duration can be adjusted to minimize risks while still providing symptom relief. The flexibility to fine-tune your treatment is one of the key reasons why HRT can be such a successful option for so many women. The bottom line is that with the various forms of HRT available, it doesn't have to be intimidating. You and your doctor can find a treatment plan that works for your lifestyle, preferences, and health goals. By offering a range of delivery methods and the ability to customize your therapy, HRT is a highly adaptable treatment that puts the power back in your hands. So if you're considering HRT, don't be afraid to explore the different options. There's a solution out there that's just right for you. Debunking common myths about HRT. One of the most persistent myths about HRT is the belief that it causes cancer, particularly breast cancer. This fear originated from the WHO study in the early 2000s. The alarming headlines that followed claimed significant increases in breast cancer risk. However, these claims were based on data from older women, many of whom were years past menopause and had pre-existing health issues. Recent research has painted a more nuanced picture, showing that healthy women in their 40s or 50s who begin HRT closer to menopause face minimal risk. In fact, there is emerging evidence suggesting that certain forms of HRT may even reduce the risk of some cancers when prescribed correctly. Another common concern is the notion that HRT leads to heart disease. This misconception also stems from the WHO study, where the data initially suggested that HRT increases the risk of heart attacks and strokes. Later analyses revealed that timing is critical. When HRT is started within 10 years of menopause onset, it can actually have cardiovascular benefits, such as improving cholesterol levels and enhancing blood vessel function. The risks are more relevant to women who begin therapy many years after menopause, as their bodies may already have underlying health issues. Many women also worry that HRT might cause dependency or addiction. This is entirely untrue. HRT does not create physical dependence like caffeine or nicotine. What women often experience is relief from their symptoms, which can make them hesitant to stop. This isn't addiction, it's simply your body benefiting from the balance that HRT provides. When it's time to discontinue therapy, it can be done gradually under a doctor's guidance to minimize any return of menopause symptoms. It's important to recognize that while HRT offers tremendous benefits, it isn't suitable for everyone. Women with a history of breast or endometrial cancer need to approach it with caution, although some targeted therapies may still be options under medical supervision. Similarly, those with active cardiovascular disease, uncontrolled hypertension, or a history of blood clots or strokes should carefully weigh the risks and benefits. Women with liver disease, since HRT is processed through the liver, may also need alternative treatments. Expert opinions on HRT have evolved significantly in recent years. The North American Menopause Society now advocates for HRT as a safe and effective option for healthy women under 60 or within 10 years of menopause onset. A 2022 study published in JAMA confirmed that HRT, when personalized and monitored, can provide substantial relief for menopause symptoms without significant risks for most women. Hormone replacement therapy isn't the villain it was made out to be. For most women under 60, the benefits of HRT far outweigh the risks. It's time to move past the fear and embrace the facts. Whether it's protecting your bones, boosting your mood, or helping you feel confident in your skin again, HRT offers real, tangible benefits. And with guidance from a healthcare provider, it could be the key to feeling like yourself again, strong, happy, and ready to tackle whatever life throws your way. So if you're struggling with menopause symptoms, don't hesitate. Talk to your doctor, explore your options, and make an informed decision. Menopause is tough, but you don't have to face it without the tools that can help you thrive. Glad you watched this video till the end. Now make sure you share it, like and subscribe for info that could help you. See you in the next one.